it's as much like shoulder blade is because I see this a million times. And then you told me basically that when you were at your desk and things happen and you assume bad posture and you're sitting for long periods of time, it gets worse, which makes sense. But when you are away from your desk, like the last 2 weeks, you can see a clear correlation. When I did a lot of like mobilizations and movements of your back, yeah, you were a little bit locked up in this region, and you're decently mobile in that region. Not so bad. That's actually kind of like somewhat what we want, somewhat. However, every time I messed around with your neck, you're like, that's not the most comfortable. That's not the most comfortable. That's not the most comfortable. But there was nothing that said, hey, that's really uncomfortable when you push on my mid back. So to clear things up and make things a little easier for you to understand, basically I evaluated your neck. I took the nerves down the neck and I kind of like tugged on them. That's what that reverse handshake was. I was seeing if there's any nerve irritations to these types of things. Congrats, nothing's wrong there. So I don't think that is an issue for you at all. I just think you have a little bit of compression and tension in the knee, into the neck that's giving a little rise to that. So let's go back to this concept. There's a few concepts. If we go down to the ankles, and this is just generally speaking, if you go down to the ankles and feet are pretty mobile, right? They have a lot of movements. They go side to side, up and down. They can go like this. The knee, on the other hand, is more like a hinge. Yes, it does have a little rotation, so it's a little bit more mobile. This one's a little bit more stable. The hip is a very dynamic ball and socket. It should be very mobile. Whereas the SI joints in the lower back are designed to be pretty stable. Now, the mid back is supposed to be pretty mobile, so it's, you see how it alters?
Yeah.
And the lower cervical spine should be fairly stable. And you're like, well, what? Really? It should? Well, that's because the upper cervical, 80% of our rotation occurs from like 2 vertebrae.
Okay.
So really, the lower area here should be stable. This one should be mobile.
Huh.
And then, of course, our skull's pretty stable.
Yeah.
Right? So
Good.
it has this alternating pattern. Typically, when we sit at a desk and we have these types of postures, our head kind of essentially goes through our shoulder, our elbow, our wrist, our hip, our knee. It kind of is like we call it a plumb line. But when it migrates here, we end up having a lot of strain that occurs right here, and that allows our turtleneck to glide forward, and then we end up having a lot more mobility and occurring in that area.
Okay.
So, of course, these areas go down to the neck and to the nerves. I don't think you irritated them. I don't think you pissed them off. I don't think you compress them. I don't think it's a disc herniation. I don't think it's disc bulge. I don't even think there's any what we call facet issues, which is a fancy word for saying like the joint capsules like that come together or that like do all these movements. But when I did stuff like this, I'm really trying to close down the nerve and really irritate it.
Okay.
I could not do that, but typically what I see in most people's neck is that when they get that shoulder blade pain, they are oftentimes irritating some of that dorsal-scapular nerve, which is right here.
Okay.
That's typically what I'm seeing in yours. So I think if we can combine that, like, you know, taking some tension off of the muscles here, giving you some stability-based exercises for the lower cervical while we give some more mobility exercises and movements through here, you will actually feel much better in a very short period of time. I think so. You've never had this worked on, and I think it's probably time to take a look at it. And you know, I think it's worth like kind of working on it, because the chances of you working on a computer today, tomorrow, next week, next year, and probably a few years down the road, even if you do a job like mine, it's probably high.
Yeah.
So we should probably learn these, because what you're going to learn, you know, throughout treatment and stuff like that is going to be stuff that will translate over just to general health anyway, and keep you mobile. But overall, this is a good problem to have, so to speak, because it's not like a major injury.
Yeah. Oh yeah.
Low level. Your words, not mine. Any questions for me?
No.
Cool.
No, that
Does
makes
that
sense.
explain? Okay.
Yeah.